Hi, Dr. Wally Pearson here. A topic that I feel does not get much attention, but certainly is literally worth its weight in gold, is prevention of potential ACL injuries, anterior cruciate ligament injuries. The ACL is a ligament inside of the knee that prevents the shin bone from coming forward on top of the thigh bone. Very important ligament. It's frequently disrupted. And while it's a relatively catastrophic injury, there is reconstruction for this, but certainly the result we achieve with ACL reconstruction is not like a God-given ACL. That being said, there are relatively successful programs to help decrease the chances of this injury occurring and keep one with their native anatomy and an intact anterior cruciate ligament. Now, these are real numbers for ACL surgery. They happen 100 to 300,000 per year. That's a very large number, and if we can achieve any sort of reduction in that number, then we have really done our population in sports medicine a huge favor. It's fun surgery to do. I enjoy doing it. I'd enjoy never doing it again if we could prevent all ACL injuries from happening. Therefore, I felt appropriate energy to form this video and hopefully decrease the incidence of predicted ACL disruptions. Now, in terms of statistic, this is something that frequently happens more commonly in females than males. Specifically, in equivalently matched sports such as soccer and basketball, where the rules are the same and the equipment is the same, females are 6 times more likely for this injury to occur than equivalently matched sports in males. It happens in pivoting sports such as basketball, soccer, volleyball, but it can happen even in activities of daily living. Now, as the number of females in sports increases proportionate to males, this is becoming really a female epidemic. 70% of ACL disruptions occur in non-contact sports. I think there's a misconception that this requires a football player to collide with another one to disrupt a ligament of that magnitude. 70% are non-contact injuries. Planting, pivoting, being in a bad body position, and the ligament pops. I've had multiple athletes who were transitioning on a ski, didn't fall at all, their knee just shifted, it disrupted while they were standing up, they glided to a stop and had a disrupted anterior cruciate ligament. And the real issue for me is that not only does this compromise one's quality of life temporarily and require a fair amount of mental and financial input, a lot of these injuries go on to progress to arthritis. The statistics show that over a 5 to 10 year period, over half of people that have disrupted their anterior cruciate ligament will end up with life-altering arthritis in the involved knee. Now, one would wonder why females are so predisposed to this injury occurring in males with equivalently matched sports and shoe wear and playing surface. And a lot of it has to do with anatomic issues. Females have a wider pelvis to accommodate childbirth, and what that does is create a Q angle at the knee where the knee's in a little bit of knock-kneed position. That really is the starting position for the disruption of the anterior cruciate ligament. When that knee is in the knock-kneed position and then there's any rotation going through the body, that really strains the ACL. So the wider pelvis is the first blow to the female anatomy, predisposing them. There are hormonal issues. There are some fancy studies that correlate ACL disruption in females with the timing of their menstrual cycle. There are hormone receptors on the anterior cruciate ligament. We don't necessarily know the chemical implications of this, but there certainly is a correlation between the time of one's menstrual cycle and ACL disruption. There are also some neuromuscular issues, and what that means is females have a little bit of a disproportion and uneven strength of their hamstring muscles in the back of their leg versus their quadriceps. Males are anatomically more aligned, if you will, to fire the muscles in appropriate order to potentially decrease an ACL disruption. Females are not. So in the prevention programs, it's important to emphasize appropriate neuromuscular training. Furthermore, females' pelvises usually have a little bit weaker muscles that hold their leg in a stable position, their trunk and their leg, such that that increases their potential to do the rotation and knock-knee alignment, again, potentially disrupting the anterior cruciate ligament. Now, the mechanism of injury for an anterior cruciate ligament, how does this happen? Well, it's a really common physical scenario. Usually happens with the athlete landing a little bit off of center, and what I mean by that is they usually land with their weight in the back seat, meaning their center of gravity is back behind the center of their rotation, the center of their knee, if you will. Usually the foot is outside their center of gravity as also. So their foot is to the outside, their center of gravity is in back, they're rotating through their knee. And if you are scrutinizing sports on TV, you're likely to see an athlete and be able to predict who ruptured their ACL and who didn't. It's very reproducible. Now, I mentioned prevention programs. Now, this is not something that we just are verbalizing because we want people to go into PT programs. They are very successful. There are many published reports that show that if you took 1,000 female athletes, put them in sports where you have a predicted rate of ACL disruption, sports such as soccer and volleyball and basketball, if you implement these programs, the decreased rate of predicted ACL disruption goes down by approximately 40%. Now reflect back to that first number that I mentioned, 100 to 300,000 ACLs per year, and if you drop that by 40%, that's the most successful thing that we've done in orthopedics. So these are serious programs. They bear fruit. They're successful, and they're certainly worth their weight if we can prevent even 20% of ACL predicted disruptions. They're not onerous programs. If they're implemented 3 times per week for 15 to 20 minutes per session, that can yield the fruit that we're talking about. That can yield a decreased disruption rate of approximately 40%. Now, these are typically correlated with a warm-up program for soccer and basketball athletes. Coaches can use this time as socialization for the athletes to communicate verbally, but be very committed to the programs. The programs are to be taken seriously, and most importantly, have to be done correctly. And that's what I'm going to spend the rest of this video addressing our attention to. Now, there's several factors involved in these programs. Now, the first one is called plyometrics. What plyometrics means is that when you're contracting a muscle in plyometrics, you lengthen it first and then shorten it. An example of that would be jumping up onto a box. You lengthen the muscle, jump up onto the box, and then jump back down. That's a very important exercise to strengthen muscles and learn where your body is in space. Balance exercises are very critical. Balancing can be standing on one leg with a warm-up partner and throwing a medicine ball back and forth. It teaches you to fire the muscles to stabilize your pelvis, to stabilize that leg, and learn where your center of gravity needs to be to stay balanced on one leg. Furthermore, strengthening stability, jumping and landing across a line on the ground or a cone. Now, with this maneuver, and all the maneuvers, but particularly this maneuver, it's really critical to perform it correctly. You're trying to teach your body a good motor memory, learning how to land in space safely. So during these exercises, it's important for the coaches not to be looking at the clipboard or thinking about the roster, who's going to be playing what rotations. They need to be visualizing the athletes and making sure that the athlete is landing with their center of gravity forward, landing on their toes. When the athlete starts to fatigue and get bad motor memory, bad landing positions, stop, rest, recover, teach yourself to land correctly. Something that I tell my athletes is that the more quietly they land, the better the landing position. And to land quietly, you have to have your center of gravity forward, you have to be landing on your toes, a nice controlled landing. When doing these exercises, if you feel like you're uncoordinated, if you're getting in a weird body position or you're making a lot of noise landing, back off, rest, start again, and get a better motor memory. Again, it's 3 times per week, 15 to 20 minutes per week, or per session, and this will yield results even within 6 weeks. Now, I've thrown a lot of big words at you and a lot of positions to practice and achieve, but there are a plethora, there are many videos on the internet, and one I'm going to refer you to that is really a well-designed program with pictures of athletes doing the exercises is called the Santa Monica ACL Injury Prevention Program. It's a YouTube video with the capital letters PEP. It has 4 steps to it. A warm-up session, which is very important, a strengthening program, the plyometrics that I mentioned, jumping up onto a box or jumping over a line, and then agility training and stretching afterwards. And again, it's not an onerous program. It's achievable in 15 to 20 minutes. It can be a good social time for athletes, but it's a very critical time. And most importantly, I'm going to reemphasize, these are exercises that have to be done with a correct body position. They'll achieve good muscle strengthening and good motor memory, and done correctly will significantly decrease the chances of an ACL disrupting in your athletes. I think if the coaches are presented with an easy program such as the Santa Barbara program that's easy to implement and bears significant fruit, I think most coaches should be committed to a program such as this. Thank you for your attention. This is worth its energy. Please follow all the examples and keep your native anterior cruciate ligaments intact. Thank you.